James, you're on the air.
Hi, Dr. Wallach. Thanks for taking my call.
Yes, sir.
First of all, let me say that we love you. You're wonderful, and we pray for you every day.
Appreciate that. Thank you so much.
I have two things I want to talk about. I want to give you some feedback because I called about 3 months ago, and then I want to tell you about another problem I'm having. Okay, so here's the feedback. I called up about 3 months ago because I was having problems with falling asleep after a meal. Well, that is now stopped. That's completely gone. And in addition to that, I lost 35 pounds since I last spoke to you.
Now, isn't that amazing?
Yeah, it's amazing. And I haven't done any exercise at all.
Well, exercise can be a negative. Yeah, exercise can be a negative when you want to lose weight. In fact, Loyola University in Chicago in January of 2009 came up with a 10-year study that said exercise alone won't make you lose weight. You have to get on a 500 a day calorie diet to use exercise as a weight loss program. And when you get back up to 1,000 calories a day, because you can't keep going on 500 calories forever, you'll gain all the weight back. And so exercise is the last thing you want to do if you really want to seriously lose weight and keep it off.
Yeah, that makes sense. So, and I am slowly getting my sleep cycle back to normal, whereas before I was getting up at like 11:30, 12 o'clock at noon. Now I'm getting up at 8 o'clock. So it's slowly moving back to where it should be. But also, I have another problem that I've had for the last couple of years. I have some kind of internal hernia where the entire left side of my groin is like bulges out every now and then, and I could push it back in. It feels like my intestines are going down into my lower abdominal area.
Sure. Okay, well, how much do you weigh?
I weigh, now I weigh 195.
Okay, and how tall are you, sir?
I'm 5'9.5".
Okay. Now, Charmaine, this is a Char thing. You know about this personally, don't you?
Yes.
What would you do? What would you suggest for James to deal with a inguinal hernia?
He needs to put a block of wood under the bottom legs of his bed, so the bed is
feet of the bed.
Feet of the bed, so it's going up a little bit. And then he needs to get a truss. My husband got a hernia, and believe it or not, he went to a surgeon last Friday morning, and he talked him out of having surgery because he said he only wears the truss when he works outdoors. But when he's inside, walking around and just doing things here and watching TV, he does not wear it. And he said, well, there's always could be trouble with surgery, complications, and it's better if it's not broke. He said, don't fix it. And he does a lot of surgeries. He said he had done 4 that week, and he was doing another one that Friday during the day. So it wasn't like he wasn't experienced in doing it, but he talked him out of having the surgery. He said, as long as you can push it back in, it's soft. Don't worry about it. If it gets hard and you can't push it back in, you'll probably also feel like throwing up. That's your bowel sticking through, and then you need to get help. But unless that happens, don't worry about it.
Yeah, and of course, the secret is here. You did exactly as we said. You put a 2x4 underneath the feet of the bed, so you guys are sleeping with your head an inch or two below the level of your feet. And that way gravity is working to pull all the intestines out of his pelvic area, which puts pressure in the inguinal area for when you have the hernia, and pulls it back up into the upper belly cavity. And that alone allows the inflammation to go away and healing to take place. And a 1-inch hole might become a 1/4 of an inch hole. Okay, and as long as you're taking the 90 essential nutrients, it wouldn't hurt to throw in some extra glucogel. Support and promote maintenance repair of cartilage, ligaments. Here we go, ligaments, tendons, connective tissue, which is what's been stretched or damaged or torn. That's the tendons and ligaments and connective tissue. And so when you let gravity help you by putting that 2x4 under the feet of the bed, so when you're sleeping for 6 to 8 hours, the gravity of the earth is helping you with a free treatment there. And so exactly right. Don't forget, keep doing what you're doing because obviously you're getting benefit. And so just keep going with what you're doing, but I would definitely put the 2x4 under the feet of the bed, get a truss, as Char says, and if you're up vertical, walking around doing things, unloading cars or mowing the lawn, that sort of stuff, wear the truss, and call us back in another month or so. Let us know how you're doing.